Good afternoon, everyone. And I will now turn it over to our Chief Medical Officer, Dr. Janice Fitzgerald, for today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. We'll start with an update on COVID-19 in our province. Since the media availability yesterday, we have 2 new positive cases. These cases are within the Eastern Health Region. Contact tracing is ongoing by Public Health, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 261. By region, we have 243 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. By age, there are 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of those 2 are in intensive care. 244 people have now recovered, and in total we have tested 9,458 people. Ebbs and flows in the number of new cases is not unexpected, especially as we begin to gradually lift some of the public health measures we've had in place for a while. If anything, it serves as an important reminder that we must not become complacent. COVID-19 is still active in our province, and we must remain keenly aware of its presence. It also helps reinforce why following the proven prevention practices is so important. Please continue to wash your hands often and well. Stay home as much as possible, especially if you are feeling ill. Cover coughs and sneezes, and maintain a safe physical distance of at least 2 arms lengths from others in public spaces. Following these recommendations over the last 2 months has played a critical role in our ability to contain this virus so far. As we learn to live with COVID-19, it will become more important than ever to continue these tried and true measures. This is our best chance to keep COVID-19 under control in our communities. It will take our continued determination and discipline, but I know we are up for the challenge. We have come too far to stop now. We are aware of an outbreak of COVID-19 at the Horizon site of the Richardson Work Camp in Alberta. Workers from Newfoundland and Labrador who have recently returned home and attended the Richardson Work Camp since April 12th are advised they must self-isolate and contact 811 immediately for appropriate follow-up. Upon calling 811, you will be referred to Public Health for testing, whether you are symptomatic or not. If you test negative, please continue to self-isolate for the remainder of the 14 days. Close and household contacts should also self-isolate while you await your test results. If you test positive, please continue to self-isolate. Public health officials will follow up with you to provide further guidance and advice. I'd like to take this opportunity to remind those who have returned from the Curl Lake, Alberta work site that they too are required to self-isolate for 14 days upon return and contact 811 for testing. As a recap for those who may have just joined us, we have 2 new cases since yesterday's media availability, and the total number of cases in the province is 261. The breakdown by health region brings us to 243 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. Protecting Newfoundlanders and Labradorians from COVID-19 remains our #1 priority. We will continue to work with you to protect everyone's health and safety. Although we have made great strides, our work is not yet complete. Overcoming this pandemic will require each of us to continue to push ahead with our relentless commitment and courage, and when we do weather the storm, I know we will come out stronger and more united than ever from having navigated through it together. We can do this. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Well, it's disappointing. 2 new cases, that's, of course, too many. But it causes us to reflect and pause on where we are today and as we move forward in living with COVID-19 in our province. Although we've been doing a very good job by being responsible and following the health guidelines that have been put in place, we must always be alert and aware of our surroundings. It is a new normal. We must adjust, we must adapt, And we have to do everything that we do in the safest way possible. The future in our province is a one with COVID-19, of course, until a vaccine and a trusted vaccine is found. And as we have said, this is a virus that has no boundaries. It could be in any community at any time. Although we can't see it, we know that it is around us. So it's only by following the health guidelines, our actions will let this virus know that it's not welcome in Newfoundland and Labrador. We have to defend ourselves. We are stronger together, we know that, and together we will get through this. We started out our briefings this week reminding everybody that this was Mental Health Week, and we heard from the Executive Director of Channel, Paula Corcoran. So I'd also like to talk a little bit more about mental health and wellness a little bit further today, as an extremely important area in our lives. We have to look after ourselves, not just today as we move through this pandemic, but every day. Advancing mental health and wellness has been the forefront of our administration. So much that in June of 2017, with a large group of people, including the Minister, we released the Towards Recovery Action Plan. The plan has 54 recommendations to improve the provincial mental health and addiction system. As of right now, those 54 recommendations, 28 of those are complete and 26 are in progress. When we reflect back at last year, we've invested some $228 million on mental health and addiction initiatives. And to put that in context, that's nearly an 8% increase if you compare that to the following year. And it's interesting, I think, if we just take a few minutes to give you a breakdown, some of examples of those investments are being made and how they're working in your communities. Some nearly $7 billion have been exactly there in community-based services. And good examples that you will see, I mentioned yesterday about Doorways, which is a walk-in counseling service and is now available in nearly 60 locations across the province. And I mentioned yesterday, if you're looking for the location nearest to you, you can call 811. We also have a mobile crisis response team, which is fairly new, but they are teams that can travel to a person's home or to a community to assist or maybe intervene in a mental health related crisis. So as we continue to advance the new adult mental health and addictions hospital, this is the replacement of the Waterford that I'm talking about, we will continue to invest. I still find it a bit difficult to believe that the institution that is currently being used opened its doors in 1855. We also know that it's important to support community programming. There's an additional $3 million, and these are community organizations like Channel, Status of Women, Choices for Youth, and the Canadian Mental Health Association, Thrive. And, I can go on and name many others, but these are examples of community organizations that are doing a great job. But also, as you recognize, and you've heard us talk quite a bit at this table on a daily basis, the use of technology has helped us get through this pandemic, but it also has a lot of value in how we treat mental health within our society as well. But it's important for us, and we recognize this, and we've invested some nearly $1.5 million into e-mental health services. So this can range anywhere from a self-help option to early intervention for both mild and to moderate mental health issues. So these are just a few examples, and there are many others. But when I talk about early intervention, there's no better place to start than within our school system. And recognizing this, we put in place some social and emotional learning resources. This is to support the health curriculum within our school system. It's no better place to start when you think of mental health. Our Towards Recovery plan is one that includes advancing health and wellness goals in Indigenous communities. So we do this by making sure that the initiatives and programs are culturally relevant, that they're safe, and they're actually tailored to meet the unique needs of the Indigenous population. So as part of the action plan, a Towards Recovery Indigenous Health Team has also been established by and with Indigenous communities. So that given this is Mental Health Week, it's important that we continue to work together to identify the mental health priorities and concerns. One of the things, in little fact, that I became aware of just lately, and not sure if many would be aware of it, is that here in St. John's, the Indigenous population is more than doubled between 2006 and 2016. It's the fastest, by the way, rate of growth of any census metropolitan area in Canada. So in an effort to improve access to cultural appropriate mental health services in Labrador, not just here in St. John's, but also in Labrador, as I've mentioned yesterday, again, there's a 6-bed mental health unit that is being co-designed with Indigenous groups and those in Labrador, and construction will soon be underway. But from time to time, people need to use air transportation to get to an appointment, and we've also made sure that we invested primarily in Labrador on a Skedevac and a Medevac service. So these are for regular appointments or for emergencies. So as a group, we are very proud of the advancements that we've made in supporting people across the province to make sure that we have healthy and vibrant communities. So we make those investments on your behalf, working with you and our communities to support you and your family. There's always a ways to go. There's always more work to be done. We have made great progress, and we will continue to focus on not only our priorities, but your priorities. So which includes an action plan for the life promotion and suicide prevention. All too often, we hear about suicides, particularly amongst our youth in our communities. But we also know that we can only be successful with proper consultation and engagement by those with lived experience and Indigenous partners to inform this ongoing plan. So making sure that those community-based services are there for you when you need them. So the Towards Recovery Plan puts a major spotlight on mental health and addictions in our province, but it's not only in Newfoundland and Labrador. There's jurisdictions outside of our province that will tell us and are looking to us as they see us as leading the way in mental health and addictions. And I want to say a big thank you to our workers at Health and Community Services, led by the Minister, for the work that they are doing. This plan all started with a community and stakeholder engagement. We know that that must continue. I also want to know that, just remind everyone that all political parties were involved in this, and we've had so many community groups as we take the leadership role now in making sure that we continue to implement the actions of this plan. I will also remind people that regardless of how you feel today, that you are not alone. And there is a website that will provide point you in the right direction, the supports and the resources that are available to our adults and youth. And that website is, of course, bridgethegap.ca. So, as I conclude my remarks today, that I also want to make mention that this is just not Mental Health Week. This is also the International Child and Youth Care Week. So I want to take this opportunity to send a sincere thank you to our child and youth care workers in our province for your continued dedication and your commitment. While each day may be different, especially during COVID-19 pandemic, your services are required regardless of what's on the go in our communities. So you remain focused with your relationships to our young people, and you support them. You support them not only by providing guidance, but you're facilitating their personal, their emotional, and their educational development. So we appreciate all that you are doing, the strength that you provide in your efforts, especially during this unprecedented time. You share our goal to ensure that the safety and well-being of our children, youth, and their families are front and center. So I also want to let you know that I see you as not only providing the comfort and the support, but you are creating some special memories for our children and youth. So thanks again for the great work that you're doing. So with that, I will conclude my remarks, and I will now turn it over to Minister Haggie.
Thank you very much, Premier. And again, the presence of 2 new cases of COVID-19 in the province is a reminder that whilst we may have gone through the first wave and in a trough, that we're not in the clear yet. It's an encouragement, if you needed one, to persist with the measures that we've heard Dr. Fitzgerald and others outline here day after day. They have worked, they've served us well, and we need to continue to use them. Yesterday, I was asked about exemptions from travel, and I referenced a figure of some 500 applications. Well, as of 9 o'clock this morning, that number had increased to 1,336. The majority of these fall into categories of people relocating to the province or caregiver requests for people coming home to support loved ones with illness and in need of some help. We are ramping up our efforts to make sure these are done on a priority basis and are working through them. I also referenced yesterday the work of staff in the department in dealing with a whole variety of issues that face the public. Unfortunately, I think with some of the workload and some of the situations that have arisen, I think tempers have maybe got a little bit short for people who've called, and some of my staff have felt somewhat challenged by that. We appreciate the stress that everyone's under and are really trying to do our best to meet that. But interestingly, today I had several emails in my inbox from healthcare workers and from people who are in essential retail saying that they felt similarly challenged by people they serve when they point out their obligation to try and keep them safe. And I think it is difficult under these times of stress sometimes to behave as one would when one is not stressed. And certainly stress has been a significant feature of life for everybody this last 8 weeks or so. Indeed, the Mental Health Council of the Mental Health Commission of Canada today announced some virtual learning for people in administrative positions around modules of caring for yourself, caring for your team, and caring for others, to help try and address this for people in management or administrative positions. And I would encourage you to look at that. The champion, the lead there, or president and CEO is an expat Newfoundlander from St. John's here, who is well connected with the province, and her work is excellent. Louise has done a grand job. The Premier has also referenced how it's nearly 3 years now since Towards Recovery was released. The underlying premise of all our work around Towards Recovery has been the idea that there can be no true health without good mental health. Mental health and addiction spending across governments successively has been something of the Cinderella of healthcare. And one of our commitments was to increase the amount of the budget from health spent on mental health and addictions to a target of 9% by 2022. I'm pleased to announce that this year we've passed the 7.1% mark and are on target for that. We have actually 3 of the long-term recommendations from Towards Recovery already completed. But again, to add a little bit more texture around mental health, there are significant increases in referrals over the last year. They're up by 36%. But we've been able to do that in a way where wait times have not increased. And in actual fact, there are now 51% fewer individuals waiting this year, compared with last year. The fact that there are more referrals is good from my point of view, because it means people are acknowledging what had been a silent problem before, and it's coming out, and people are more prepared to talk about it. And I've referenced stigma and discrimination on previous days. We talked about how you get access to mental health during situations such as this, where physical distancing is important. The Premier referenced bridgethegap.ca. That has seen a 406% increase in traffic between March of last year and March of this year. On there, as the Premier referenced, has been a variety of suites of things, and as it is time to think about children and youth in our province because of the week the Premier just referenced, one of the programs that has been established here and pioneered here, which has now become sought after in other jurisdictions, is called Strongest Families. It's a flexible program, and it can be done at home, it can be done in the evenings for parents, and it provides families with tools to do this. And I think I could do no better than read just a brief testimonial from a child who said, "The thing I like most about the program was learning new skills when I'm worried. The program helped me to be able to go to my friends without mom, to bike without mom, and to get on the bus, and I'm proud of myself." Obviously, some of those activities now have to be modified a little. But again, from a 14-year-old LGBTQ identified youth, I like knowing that I'm not alone in this. And the Premier had just referenced that in general, we are all in this together, and we may not be in the same boat, but we're certainly in the same storm. So I don't think there's any need for me to continue with a catalogue of changes towards recovery. It speaks for itself. It is a landmark that other jurisdictions in Canada are coming to us now to see how to do it best. And it's a testament to all-party collaboration and significant effort on various groups' parts, both community and government. Again, just to reference youth, there are graduation ceremonies that would have happened in my own district, and I'm sure I'm not alone. And I think it's worth just reflecting on some of the local innovative ways to try and celebrate those, recognizing that this will be a grad unlike any other for the graduating class of 2020. And I take my hat off to them and their parents and their friends for coming up with some really fun ways of trying to do this. So again, I just conclude by saying, as Dr. Fitzgerald has had, hold fast, hold the line. We've done this, we've done well, but we need to stay in our bubble. We need to protect that bubble, enlarged as it might be, and we need to respect and not damage anybody else's bubble. So thank you very much, Premier. I'll stop there. Thank you.
Thank you, Minister. So we now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues, so all other government issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. I will call on each reporter by name to ask questions, so please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Ben Murphy of BOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, just wondering what else you can tell us about these 2 new cases today. Were they linked to the healthcare workers in isolation?
No, as far as I know, they were not. One was related to the Curl Lake outbreak, and the other one, the investigation is ongoing, but preliminary information doesn't indicate that it's related to the healthcare situation at Eastern Health.
Okay, and Dr. Fitzgerald, we've heard from a number of people who say they've experienced bad flu-like symptoms, feeling like it was the worst flu they've ever had in late December. Is there any chance these people could have had COVID-19 and not known? And could they possibly be tested again to see if that is a possibility?
So it's unlikely. There was influenza going around at that time, which could still make people feel pretty miserable. And a lot of people think they have the flu in the past, but actually don't have influenza. They have another virus. So an influenza compared to those other viruses can actually feel quite severe. So it's more likely that it was a different virus that they had. Anyone who had symptoms back then doing this test that we do now would not be helpful, because it's very unlikely that they would be still having any virus particles. Like this test has to actually detect the virus in your body when you're sick. So it would be very unlikely that that would be the case right now.
And I know you have gone over this, but the reality is really starting to kick in for many, as May 11th is just this coming Monday. Can you just explain exactly how life is going to change for people when we move from alert level 5 to alert level 4, as I know there is still some confusion around that note of gatherings of up to 10 people are permitted?
So gatherings of up to 10 people would refer to organized gatherings. So with regard to funerals, with regard to other ceremonies of that similar type of ceremonies, then if they're organized, you can plan for physical distancing, you can plan for the appropriate hygiene measures, all of that, then those types of gatherings are permitted. It is not meant for people to be out gathering with people outside of their bubble, getting together in your backyard, social distancing, people being who they are, friends being who they are. Social distancing is not likely to be maintained in that situation for a prolonged period of time, and you'll end up then bursting your own bubble, right? So really, when we're talking about gatherings, it's about organized gatherings coming together with some very strict rules, rules about how people should be interacting at those gatherings and not casual gatherings between groups of people.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier Ball, the federal government announced today money allocated for pay raises, but that will also be in conjunction with the provincial government. How much and can the province afford to do this?
No, we can afford to participate. It's a cost-shared arrangement, but there's a significant benefit here to the province and for the essential workers that would be the recipients here. So it's for us. It's we've been talking quite a bit lately about the cost-share analysis, but we have money available to allow us as a province to be able to participate, and we will be participating. We're currently working out the details. Some provinces have already done this, and it's got their processes established. But for us right now, we're working out our details. But this is a program that we will be participating in on behalf of our essential workers.
Thank you. And information commissioners across the country released a joint statement today and has released some more principles. Will the government be following those principles?
We've had discussions with our own privacy commissioner as recently as this week, if I'm not much mistaken, and certainly my read of that document is it's entirely consistent with our approach.
Thank you. And my final question. With the restrictions on travel and for those looking for exemptions into the province, I'm wondering from the airline's perspective how much this is going to impact travel in the future for Newfoundland and Labrador, and if we're going to see a large reduction in flights to the province.
I think from the point of view of travel by air, there's been a massive reduction already in travel, simply in reaction to the reality of people, quite wisely, simply wanting to stay home in their bubble. From a sort of go-forward basis, I think it really depends on how long this lasts and to what extent all jurisdictions in Canada, for example, find themselves moving to, say, alert level 1 or whatever their equivalent is. And those are going to be commercial decisions. The airlines will make those based on load factors and passenger demand. And I think that's probably, given some of the discussions we've had in my own district, for example, about getting flights into Gander, those are not ones that are made on any other metric.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Backlog of about 6,000 surgeries. I wonder if you could give some more details regarding backlogs for things like tests and other appointments in the healthcare system, and how, give a little detail also as well about how those backlogs compare to wait lists before the pandemic struck the province.
That's a good question. It's difficult to give you a comparator beforehand because for a lot of situations, wait lists are not managed solely by the regional health authorities for procedures, for example. They work by and large on a rolling 3-week cycle. The bulk of the wait lists, particularly in Metro, are actually split between private offices and the RHAs. So what we can tell you with some certainty is the number of cases that had been intended to have been performed in surgical settings. And today's figure that I had sight of was just over 5,500. In actual fact, I was a bit pessimistic yesterday. As of Monday, each regional health authority will be following broadly similar principles, but they will be making their own announcements as to how they intend to address the particulars of those backlogs. And I would await their announcements. My understanding is Eastern Health, for example, has already started making some phone calls, but I couldn't tell you whether that was for diagnostics or for procedures themselves. What I would suggest is that those are operational issues, and each RHA has a plan, and that will be released, if not tomorrow, then certainly by Monday.
And we know that procedures were reduced to maintain hospital capacity. You've said about half of hospital beds are unoccupied in a preparation for a surge. But as you know, has our measure of having capacity changed? In other words, are we, like, what does maintaining capacity look like as more procedures are permitted as of Monday and we go to level 4? Is there a different benchmark that will be in play?
We're looking at the balance between a potential surge and the ability of the regional health authorities to manage that. That will depend on empty beds, and as of today, 58% of beds across the province in acute care are currently occupied. This changes on a daily basis, and indeed, in actual fact, changes on an hourly basis often. The other piece is around, do we have PPE to manage COVID surges? So the first tranche, I think, of procedures that were contemplated, if I read Dr. Fitzgerald's orders accurately, would be those which would place minimal demands on inpatient beds in the first instance, and also be done in a way that would minimize a large number of face-to-face interactions. What will then happen is those changes will be reassessed. At some point, we're going to have to continue to keep beds free, but whether that is 20% of our capacity or 40% of our capacity, the modeling and predictive analytics from Dr. Rahman's group, which he gives us on a rolling 30-day cycle, those will help. And we're also working on a predictive model for PPE demands. BC, I think, has the furthest advanced with that kind of modelling, but that's of interest nationally as well. And no doubt these will all be discussed tomorrow on the health ministers' meeting.
And we've been hearing also that there's been reduced amounts of people presenting with symptoms of heart attacks, severe conditions like those. Thinking that they shouldn't go to hospital because they're doing a favor or they're participating in what they're being asked to do. Do you have a message for people who might be in that situation in terms of making sure that the system is still treating people with urgent needs?
The system is still there for people with urgent needs, and I think that's a very important message to get out there. We have, through the RHAs, made every available effort to try and make a visit to the emergency department as safe as possible. I certainly know there's been a significant reduction in emergency room visits. I don't know that I'd be able to be in a position to confirm what you're saying, that people with serious conditions are staying away, or whether it's people who have decided not to go for things that they may have regarded as perhaps less severe and dealt with them through 811 or at home. Certainly 811 has seen significant increase in calls. Their call volume is usually a couple of hundred a day, and at the peak in March it was well over 2,000 in one 24-hour period.
Our next questions are from Peter Jackson of the Telegram. Please go ahead. Is Peter Jackson on the line, operator?
Yes, we invite Mr. Yes, he has just pressed star 1. One moment, please.
Please go ahead, Peter.
Into one. Will the wage top up today for essential workers, will that help people who have been left out of significant income because they can't work outside a care home like they normally did?
Yeah, so far as the program is being designed, and as I mentioned earlier, Peter, there's a number of different provinces are approaching this in many different ways. Some are looking at an hourly based, enhancement. Some are looking at a just, almost like an incentive bonus type where you get a larger sum of money just on the, one-time larger sum of money. So there's a number of options that we're currently considering right now. But from who gets the plan or the money would be based on the hours that they could have worked, as an example. But also there's a broad range of essential workers that have been designed by some federal initiatives, some federal programs. So these are the kinds of people that we would want to get included. And also, we also know that there's been some decisions that's been made by government where people can only work at one site. Of course, they would be included as well.
Okay, thank you. there's been a lot of pushback from part-time residents. Many of these people are expatriates. They have a secondary home here. Why is it that they cannot follow quarantine rules and physical distancing like anyone else from here who arrives back?
So our plan as we move forward, one of the indicators that is in our plan is the control of the importation of travel-related cases. So, or external cases. So we wanted to ensure that we could control that the best way possible, and this certainly seemed to be the best way to do that. It's very important to make sure that we keep those. Right now, our level circulating in our communities is low, and we want to keep that low, and our biggest risk is importation.
Okay. And the other thing I wanted to follow up on was outdoor tennis courts. Why are these excluded from Monday when there's no change room or anything like that involved?
So tennis courts are, if we're comparing them to golf, it's a little bit different. In golf, there is, you bring your own clubs, you use your own equipment, you can stay separated. With tennis, there is some sharing of equipment and certainly the ball. So there is a little bit more concern with regard to possible transmission.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Earlier on, you were talking a bit about children. They've now sort of had 50 days without being in a regular classroom, and with the rest of the school year essentially canceled, facing another 4 months. As part of the reopening plan, there's been a lot of focus on health and business and recreation. How much did the needs of children factor into these decisions?
So the needs of children into the education system, we've been primarily working with the English School District and the Francophone School District. So right now we realize that the classroom setting as it used to exist pre-COVID days would be very difficult to have such a setting at as of Monday in alert level 4. So right now the decision has been made, working with the NLTA and the districts, to make sure that we continue learning in the best way possible outside of the classroom. So you always factor in the emotional needs, the effect on mental health, and just the socializing that we would see within our students. That is always a factor. But the deciding factor really comes down to the public health decision that we must be able to do this in a safe way, and look at measures then that we can add mental health supports to people of all ages. And I think parents have done a real good job. I think there's a lot of great examples of where teachers have done a real good job with this in the back of their mind, that mental health is extremely important, but the decision to keep schools closed was one of physical health and to stop the transmission of the virus.
A lot of other provinces are opening up campgrounds over the next month, including for overnight camping. Why are we considering it higher risk than other areas, and has there been consultation with the campground owners about ways that they could possibly do it while minimizing the risks, for example, of gathering?
So the concern is more about the interactions that will happen while people are camping, and the difficulty sometimes that there is in trying to control the way that people are gathering. So, and that is why we made the decision we did. Certainly, part of this whole process of de-escalation is to consult. And so we welcome consultation with any group that wants to do that.
And Dr. Fitzgerald, a question for you about testing. A lot of people see testing as very definite. It shows either you have COVID or you don't. What should people be considering when they see the statistics about testing and people testing positive and negative, and also when they're getting tested themselves?
So the test that we have is just one point in time. So when you get infected with any virus, and with COVID in particular, you don't necessarily test positive from the moment that you're infected with COVID. It takes a while for that test, for you to build up enough virus in your system to be able to test positive. So, and So if you get tested early on in the disease, you may test negative, but actually still be infected with COVID. The other thing is that we know COVID starts up in the nose and it can move down into the lungs. So if you test somebody, if you test somebody with a nasal swab at a time when they have symptoms in their lungs, you may not get a positive result. So a test is only as good as the clinical picture and the question that you're trying to answer. So you can be falsely reassured by a negative test. So certainly all of the public health measures that we have in place still apply, even if your test comes back negative. And that's part of the reason why we have seen these people who've tested negative as their symptoms worsen, they go on to get another test done and then they test positive.
One of the big concerns about opening up the economy and, obviously de-escalating some of the measures that's been put in place and why a big focus on testing is about the capacity within the system to test, as likewise the capacity within the healthcare system to be able to respond to a flare-up or a setback as we move our way and with de-escalating the measures that have been put in place on the advice of public health. But we also must make sure, like we have an adequate supply of PPE, the capacity within the healthcare system to be able to respond, and the ability to test and have the capacity to do the appropriate testing. So this is about what much of the debate is about, and that'll be a focus on our debate tonight as we speak with the Prime Minister and other premiers. So the capacity to test is what's leading most of the discussion in recent weeks.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. This is a question about the top-up program. How will this province define what an essential worker is?
So there's the definition of essential workers, and this has been put in place by the federal government, and that is the definition that we're currently looking at right now. Is a very broad definition, includes healthcare workers, but also essential workers that would work in other environments as well. So there is a definition that's been put in place by the federal government, and this is currently the definition that we're looking at to participate in the top-up program.
Okay, so would you be able to tell me, what other, besides healthcare workers, that would include?
That would include people that have been working in, say, as an example, grocery stores. This would include people that provide cleaning services. And there's a wide range of individuals within the population. And there's quite a few people within the province right now that would be considered to be essential workers under this program. That information is available on the website. And we'll make sure once the program is finalized, it's not finalized yet. There is some, processing that would need to be done, and making sure that once the decision is made, we can actually get it into the hands of the people in our province, because it is a provincial system that we would need to rely on. But it's a very general, broad range of essential workers that have been currently responding to support our citizens during this pandemic.
And according to the government alert levels, restaurants can open up at alert level 3, which could be June. But the website doesn't really say what those restrictions will be besides, no buffets and limited occupancy. Can you give some more clarification to this? I know restaurant owners are looking for that right now as they plan.
So there will be restrictions. Obviously, things like physical distancing, hygiene, cleaning, all of those things will have to be in place, which are really a lot of the advice that we've been giving all along up to now. And certainly as we move forward and move through level 4, we'll be engaging with those industries to discuss that plan further and to get feedback from them.
Right, and as a follow-up, could there be any additional support for the restaurant industry? It's moving into the summer season, and they heavily rely on tourists, which they may lose this year.
So from the tourism, from the travel, I missed the first part of the question.
It was about support for restaurants from the lack of tourists.
Yeah, so there's a number of sorry, I couldn't catch the first part of the question. So what I think where you're going here is the impact on businesses. So there's a fair amount of federal support that's out there already to support businesses that have lost income related to COVID. We're currently engaged with the business community and others in a broad range of discussions that will actually report back and to see what provincial support can be available. We all know the financial situation of the province of Newfoundland and Labrador, but there could be some cases on regulation and so on that we can work with them, to support their businesses. But in terms of the federal supports that are in place, things like the rental income or rental support with landlords, that'll be a cost-shared program with the federal government and with the province that we'll be participating in as well. So sorry I didn't catch the first part of your question, but it really comes down to the federal supports and the level of engagement that's currently going on, and we'll be making a decision over the coming weeks what level of provincial support that can be available to those people in that sector.
Thank you.
We have about 14 minutes left for our call, so I'm going to give each reporter an opportunity to ask one more question and a quick follow-up. So we'll start again with Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, quite a few people are asking about traveling from Labrador to the island during this travel ban. How exactly does that work, or is that allowed?
So we've placed no restrictions from a legal point of view on travel within the province. We have asked people to avoid non-essential travel because that is a sound public health measure to try to reduce your risk of contact with other people. So that would be our recommendation.
So much of the discussion around travel within Labrador is not as a result of the special orders that have been put in place, the measures that have been put in place by the Chief Medical Officer, but they've been enhanced by the residents within Labrador. We've been having ongoing discussions with, in communities and community leaders throughout Labrador, and they've been requested that we put some more, restrictions, more stricter arrangements on travel. As an example, the communities on the North Coast, so we have continued a dialogue with the leadership there, and they've been participating because primarily the only way to get in there right now would be through air services. So they've been engaged with the provider of that service and just making sure that everyone's aware of what's happening within their communities and people that are coming in there and so on, not by name, but by the numbers and indeed what they were doing there, why they're deemed essential going in there. Lots of discussion in the Lab West area, lots of discussion even around community movement. As an example, from Churchill Falls into Lab West or Happy Valley Goose Bay into Churchill Falls or even in the Straits area. So there's been a very wide and broad discussion about what's happening with travel in Labrador, as they've been very concerned about making sure that we stop the spread of the virus. So a lot of the restrictions that have been put in place are not as a result of the special measures orders that have been put in place, but working with the community leaders throughout Labrador. So we hopefully been having another discussion now on Saturday, and based on where we see ourselves going with Alert Level 4, there might be room for some changes in that area as well, but we'll be working with those leaders to make those decisions.
And Dr. Fitzgerald, I guess I'm just a little confused as to why temporary workers or temporary foreign workers are allowed in without having to self-isolate and work, yet workers from here in, let's say, Alberta or up north or elsewhere have to self-isolate whenever they come home.
Temporary foreign workers do have to self-isolate when they come to the province.
But hasn't it been said that they do not and they can go and work side by side with these employees? I'm just trying to clarify here.
No, so there is an order that says that all temporary foreign workers must isolate for 2 weeks prior to starting work, and that their employers actually have to submit an isolation plan for those workers.
Okay, thanks.
Yeah, so this is a federal program, just so that everyone's aware. The temporary foreign workers is a federal program. So in this case, businesses would have to apply. The decision is made if the labor force is available within Newfoundland and Labrador, and the Chief Medical Officer is absolutely right. When you enter the province, you must isolate for 14 days before going to work, and I understand they're tested before they actually begin their travel to Canada and then into Newfoundland and Labrador, when immediately as they get here, they have to self-isolate before going to work.
All right, thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. And looking through the alert levels, the restrictions on hospital visitors remain the same throughout all the alert levels until we get to alert level 1. I'm wondering at any point, will this change for pregnant people and their partners?
So yes, and when we released the plan, we did discuss that a little. We have not made any recommendations about it at this point in time because we felt that we had to look at the epidemiology of what was happening in the province at each of those levels and make recommendations based on that. So we didn't want to put any information out there that we might then have to change. So to save confusion, we would do that level by level.
I think the point needs to be emphasized that healthcare workers and healthcare facilities need to be protected to allow healthcare providers to do their jobs. We have been very successful in that regard with these measures. They've not been easy, and certainly around long-term care where the most vulnerable of our citizens live. We have really done very well so far in keeping the virus out and under control. Draw to your attention that whilst it would be great to be able to help our seniors out with that social contact directly, that half of yesterday's deaths in Canada occurred in long-term care facilities in one city, in one province.
Thank you. And with the new pay increase and this release from the federal government coming in, does it not make it a bit more apparent how much we need to raise minimum wage here in Newfoundland and Labrador?
Well, that's an ongoing discussion, and there's a mechanism in place, as you know, where this gets reviewed. But there's no question that, you know, there's during this pandemic, there's room where we can actually provide support, working with the federal government. It's in recognition of some of the strain and stress that has been created for individuals that have worked in this very stressful and trying time. And so the federal government has stepped up here to provide, you know, most of the support, but it requires the provinces. You just can't simply get the federal money. It requires the provinces to participate on a cost-shared basis. And with that in mind, you know, we're working with the federal government to make sure that we're in a position to be able to support those essential workers who provided, you know, some great service during this pandemic.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead. If Patrick doesn't have any questions, we'll move on to Peter Jackson of the Telegram. Please go ahead.
I do apologize, Patrick. Butler's line is open.
Okay, go ahead, Peter. Patrick, sorry.
Peter. Patrick.
We got two Peters and one Patrick.
I'm sorry, it is Patrick. Your line is open. If you're using a speakerphone, please pick up your handset, unmute your line. Mr. Butler? Really, I'm sorry.
Hello, I'm sorry, I was on mute. When we move to allowing gatherings of a maximum of 10 people on Monday, will that mean that the max occupancy of public spaces such as grocery stores will increase as well?
So we haven't made any recommendations with regard to grocery stores. We certainly want grocery stores to be able to admit people so that physical distancing can still be maintained. We think that's very important. As we said before, the measures that are in place in some of these larger stores right now need to continue throughout all of the levels of our recovery plan, because physical distancing is something that has to continue throughout all levels, as well as proper hand washing and, you know, all of those public health measures that we've been touting for so long.
Thank you. And my other question is related to the new order related to the Horizon work site. Is this a new? I didn't believe this is a new sort of outbreak happened. Why is the? Correct me if I'm wrong. If I'm wrong on that, but why is the province moving on this particular outbreak right now?
So we received notice that there were cases in this work camp in Alberta, and there is several hundred people for sure from outside of Alberta who work at this camp. Newfoundlanders are almost certainly to be amongst those, and so we want to make sure, once again, because we do need to control the importation of cases, we want to make sure that we're capturing those people as quickly as possible, and if any of them are positive, to find them and do their contact tracing.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi.
Hi.
Okay. This may have been answered before, but do we know whether the two new cases are travel or family related?
So one case is related to the Curl Lake outbreak, and the other one, the investigation is ongoing.
Okay. And the other question I have is the patient who precipitated the mass quarantine at HSC. Has that person been tested since Monday, and what are the results if so?
My understanding is that the sequence of tests was positive initially, 2 negative on the intensive care unit. The patient was returned to the floor, deteriorated, went back to intensive care unit and had 2 different swabs done at the same time. One was positive, one was negative. Since then, they have had 2 negative swabs.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Fitzgerald, the fish plant in Old Perlican has told workers not to bring their own food. Some people are upset about that, and that I guess they're providing food. Is that based on your advice, and how big of a risk is bringing food compared to the other risks in a workplace like a fish plant?
So we've given advice to fish plants about how to do things safely, and one of those advices was around, break rooms and that sort of thing. So I'm not really sure what kind of food the fish plant employers would be providing, but if it's prepackaged meals, I guess that certainly is a safe way of doing it. It's important for workers to not be close together when they're eating, to maintain physical distancing and avoid sharing food. That's a big no-no. So compared to bringing your own food, I think if you bring your own food and you're able to physically distance and not eat together and that sort of thing, then that may be okay as well. But I certainly would leave it to the employers within that facility to decide what they think is the most effective way that they can abide by the guidelines that we've set out.
Thank you. And when you look at the death rate in the province with the 3 deaths we've had, our death rate is substantially lower than a lot of other Canadian jurisdictions. Why is that?
I think we have been very lucky that we haven't had large outbreaks in long-term care, and I hesitate to say that, but it's a lot of the deaths that we're seeing, as the minister said recently, just a minute ago, 50% of the deaths yesterday were due to long-term care, people who were living in long-term care facilities. So I think that certainly makes a difference with regard to the death rate. It's very hard to really make comparisons when you have smaller numbers, and so I don't know that it's really fair to make those comparisons between us and elsewhere at this point. Not that we want more deaths, I'm sorry.
No, and I think it would be worth repeating that point, because Dr. Rahman has made it on a couple of occasions. Our hospitalization rate is low, and our death rate, fortunately, has been low. But because those numbers are so small, they may not actually reflect the epidemiology of the virus. And it would be very unwise, in his view, to draw any conclusions from such small numbers.
Thank you.
Operator, if we could just keep this line open just for a couple of minutes. We're going to hear from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
So the government expanded the testing criteria for COVID to 2 or more symptoms. And I'm curious, could that potentially be expanded even further to just 1 symptom or something else?
Certainly we look at symptoms and the emergent evidence all the time to decide how we should test and who we should test. And so it's quite possible that could change. If you're looking at changing it down to 1 symptom, you might have to consider that opens it up to a broader set of criteria, and we do have to think about testing capacity and PPE and all of those things. So, there's a lot to consider when you're making those decisions, but certainly if the evidence is overwhelming towards expanding the definition, then we will certainly do that.
Thank you.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening.